Good morning, everyone. I'm Desmar Walks, and I'm the new Health Authority Medical Director for APH in Travis County, City of Austin. I'd like to give you a situational update on COVID-19 in Travis County. This graph shows us the progression of case numbers since the beginning of the pandemic, and we see that our case numbers are dropping. We have a total number of cases right now of 83,962 cases, 229 active, and we've had, unfortunately, 873 deaths. Next slide, please. This compares the 6 major metropolitan areas in Texas as far as cases go. And we see that Travis County has the fewest number of cases as compared to those other areas in Bexar County, Harris, Dallas, El Paso, and Lubbock counties. Lubbock County has fewer than Travis, but we're much lower than the other higher counties. So, next slide, please. Can you go to the next slide? I'm going to cover this later on. Next slide. This slide shows, again, our case numbers, and our numbers continue to fall since our second peak in mid-January. Next slide, please. When we look at the UT consortium data, it shows that given our current trajectory, we'll continue to show a decline in cases. All things considered, if the Memorial Day weekend and the recent graduation celebrations were carried out in a COVID-wise fashion, we're hoping that that trend will continue. And so far it has been holding steady. Next slide, please. This looks at our admissions and discharges over the course of the pandemic. And next slide. To break that down a little bit further, we have, as of June 7th, 78 COVID cases in-house, 30 patients in ICU, and 14 of those patients on ventilators. In the last 24 hours, there have been 11 admissions and 11 discharges, which keeps us at the stage 2 level. Next slide, please. Next slide. And then if we look at our hospitalizations based on age, we see that there's been a slight increase in the number of cases admitted to the hospital in the age range of 80 and above. We've gone from 7 cases to 14 this past week. There's been a slight decrease in the age 20 to 29 age group, and a slight uptick in the 30 to 39 age group. Next slide, please. One thing that I neglected to mention on the previous slide is that our 7-day moving average on hospitalizations is 11 admissions per day. On this slide, we're looking at the school-age children in our county and what their positivity rate is. And we see that high school-age children have a positivity rate of 2.4%, middle school 1.3%. That's up just a little bit from the previous period of May 16th through May 22nd when we reported a 1.9%. Elementary school shows a positivity rate of 1.6%. That too is up a little bit from the 1.3% when it was last reported to you in the May 16th through 22nd timeframe. And preschool children have a positivity rate of 0.8%, which is again up just slightly from the 0.6%. And this likely is due to schools now out. We've had some graduation activities and other extracurricular activities. So it again stresses the need for us to be COVID wise and wear masks, social distance, wash hands, and get those that are unvaccinated vaccinated. Next slide, please. If we break the admission information down based on race, for the past week of May 31st through June 6th, you'll see that we've had 22 cases in the Hispanic population, 41 reported as white. We've had 14 reported as Black, 3 reported as Asian, and 2 as other, which is a category that's used when people do not want to report and or there's several different races, and so they default to the other category. Next slide, please. And can you go to the next slide, please? If we look at the data regarding deaths in, again, those 6 counties with large metropolitan areas, you'll see that Travis County has the fewest deaths at 80 per 100,000, 80.4 per 100,000. And then the numbers are there listed for the other counties. Next slide, please. To further break that down, just comparing the highest death rate, unfortunately, being listed for El Paso and the lowest for Travis, I wanted to look a little bit more closely at our high-risk populations, and this looks at the Black residents in our county. In El Paso, where Blacks represent 3.1% of the population, they represent 1.3% of the deaths. And in Travis County, where Blacks represent 8% of the population, they represent 10.5% of the deaths. Next slide, please. And looking again at Hispanics, who also represent a high percentage of the groups that is disproportionately affected by disease burden, illness, and death. In El Paso, Hispanics represent 82.8% of the population and 89.4% of deaths. And in Travis, where the Hispanic population represents 33.6% of the population and 46.3% of deaths. Next slide, please. This slide's looking at breakthrough cases, which are cases that develop in those who've been vaccinated. Yesterday, the CDC director, Dr. Rochelle Walensky, did a press release to encourage people to be vaccinated by discussing some of the post-release data that shows that 81% of folks are protected after 1 dose of vaccine, and 91% who are fully vaccinated are protected from disease and have less severe illness, less fever, chills, 2 days less time in bed, so less severe illness if they do have a breakthrough case. And in Travis County, we've delivered 1,092,827 doses and have only had 158 breakthrough cases. We've had 30 males, 54 females who've received Pfizer who've had breakthrough cases, 10 males, 37 females who've received Moderna who've had a breakthrough of COVID-19, and 9 males and 18 females who've received the Johnson & Johnson who've had breakthrough. Next slide, please. And then another area of concern, the variants of concern, the B117, the UK, the B1351, the South African and the P1, the Brazil, and then the one B1427 and B1429, which are the California variants. We've had no new cases of the variant this week. 51% of the variants that we've seen thus far have been in females, and the age range is anywhere from 8 to 87 years of age. 4 of the cases that have been seen in total, 3 of the 265 were cases related to foreign travel, 2 from Mexico, 1 from the UK, and 1 from Dubai. Next slide, please. So we are in stage 2, and this is just a reminder of what that represents for us. 5 to 14 7-day moving average of hospital admissions. To get to stage 1, we're looking at getting below 5 on our 7-day moving average of hospitalizations, or reaching 70 to 90% vaccination herd immunity being achieved. And of course, this decision will be made based on all the factors that are occurring at the time that the decision's made, but these are some of the general guidelines for this. We're really close. We have been shown by the UT consortium data that we're going to have probably a little bit more of a prolonged stage 2, given that masks are not mandated, so it's more of a personal choice, which we're urging all to make that choice, to be COVID-wise, to wear masks, wash hands, social distance, and try to, when possible, be in situations outdoors when you're with crowds of people, especially people that you're not living with and who are unvaccinated. And we urge that everybody take advantage of being vaccinated so that we can get to the stage 1 scenario. There's been a sense that we're at the end of this. We are not. Those of us who are physicians practicing and treating patients remember and see still people who have had COVID and get it again. I've seen patients who have been impacted to the point where they've had memory issues and had to relearn their job, been very weak and tired and short of breath for several weeks. I've seen the heartbreak of somebody who's young getting COVID with very mild illness and then finding themselves faced with the guilt of having been with somebody that's older than them and their family that they love dearly who got the disease and succumbed to it. So next slide, please. If you look at our current state of progress toward herd immunity, we have 45% of our population fully vaccinated, 13% partially vaccinated, 7% confirmed cases, and then that 12% of estimated additional cases is based on a factor that's been calculated by the consortium that we arrive at by multiplying our population number by that factor to come up with the 12%. And those are people that may have mild illness or for whatever reason have not been tested and identified. And then we have 23% of people who are vulnerable, and those include people who are unvaccinated. So I urge us to use our same energy that we use to get the vote out and get the vax out. Let's get people vaccinated. Thank you, sir, for listening to this presentation, and I pass it on to Adrian.
Thank you for sending that notification asking me to unmute myself. I couldn't find the button. Good morning. Adrian Stirrup, Interim Director for Austin Public Health. Um, so the first slide that we see here is our typical update from the vaccine dashboard, which shows the number of doses combined from Austin Public Health and community care. For this week, for the week ending 6/5, I know there was a lot of interest about zip code penetration. So this shows the number of or clients in particular zip codes that were vaccinated during that week. The lighter numbers representing areas of opportunity. If you look at the Travis County data from DISHS, you can see where we are broken out by race and ethnicity. The number for other and unknown is something that our EPIs want to dig into deeper. Anecdotally, we know that these numbers represent individuals who were uncomfortable with selecting or identifying their race and ethnicity when filling out the registration information. And we're hoping with a little digging that we'll see that there's some underrepresentation of the numbers for Black and Hispanic in our county. Going to the next slide, we can see the report by age, 12 and up. We have 55% of our population fully vaccinated. And the number for the 12 to 15-year-olds, I know that was of interest last time. We have 20,534 residents in between the ages of 12 to 15 who have received at least one dose of the vaccine. For ages 65 and up, we're at 75% fully vaccinated. And so now this map looks at first dose distribution by zip code. Again, the lighter numbers are where we are less than 50% of vaccine penetration. And this is the type of map that we are using to inform our community-based and pop-up strategy. And so this map, I will say, is as of May 28th, and we hope to update it bi-weekly and share with commissioners and council. Of note, in 78744, we have our Southeast Library Clinic, so we're hoping that those numbers will increase. And in 78758 is where the Little Walnut Creek Clinic is. So again, we're hoping that as we drive residents to these two areas, that we'll see an increase for those particular zip codes, and that as we continue to work on our pop-up strategies, we'll be able to focus on those lighter shaded areas. If you look at distribution by week, broken out by race and ethnicity, you can see in the beginning here in January is when we were mostly focused on our mass vaccination pod at Delco. Week 14 is where it gets really interesting, where we see greater representation or a greater diversity of representation. And this is the week that our pop-up strategy and some more of our community-based clinics were in full swing. And so we can see that there is a good increase in the Hispanic population with the implementation of these strategies. The representation of the Asian population is on par with their representation of the community. We're still seeing numbers that need to improve in the Black and African American community. And then if you look at it further by specific subgroup broken out by week, you can see here for the Asian population, it's remained at a good pace. Here for the Black population, we can see the increases towards the end of March, and then the spikes again in May and in June, where we had more concentrated efforts with our faith-based partners. In the Hispanic population, again, we can see significant increases. This week in February, I believe, represents when we did that first clinic at Sacred Heart. And then you see the numbers steadily improve as we begin to implement more of those clinics at Sacred Heart and at other faith-based communities in the Hispanic Latinx population. And then just to take a look at it by sites here, this shows the breakdown for Little Walnut Creek, Pflugerville, and Southeast Library. And we can see that there's a good representation in the Hispanic Latinx population. Again, in the Asian population, some work to do with Black and African Americans. If you look at the pop-up sites, and these include Greater Mount Zion Baptist Church, which is on Tannehill Lane, Iglesias, El Shaddai, Our Lady of Guadalupe, Sacred Heart, and St. James Missionary, we see significant increases in the number of Hispanic and Latinx residents that took advantage of those clinics. And here at St. James, a significant amount of Black and African American residents that took advantage of that clinic. And then just to compare, because the EPIs thought it was important to our mass vaccination sites, to point out that even though the proportion of Hispanic and Black residents were low at these sites proportionately, they did play an important part in vaccinating members of that population, because the numbers here are significant, 4,677. So there is some efficacy with the mass vaccination sites for vaccinating our populations of color. And then again, this shows the breakout for Sacred Heart, just to demonstrate how a focused outreach strategy can have a greater impact. And again, breaking it out for St. James Missionary to show the increase in the proportion of Black and African Americans that sought out vaccinations at that site. And so we find that information encouraging, and we plan to continue along that course using the updated maps to draw attention to areas of focus. For Juneteenth, which is Friday, June 18th, we have made the decision to keep operations open. It's a holiday now for city employees as well as many state employees, and we're hoping that folks will take the opportunity of the day off to go get vaccinated. Our PIO is working on a full push to drive people to these events. The first one is in partnership with Grant AME Church on Kramer Lane. And then we'll have our standard operations open at Little Walnut Creek and at Southeast Library at the hours listed here. And then on the day of festivities, where most of our community celebrates Juneteenth, we continue to plan to have a presence. We will be at Little Walnut Creek Library, working with our partners at the county. We plan to be at Del Valley. We are in conversations with the organizers for the celebrations planned for Rosewood and for Gibbons Park to be present. And we are also planned or scheduled to be at Our Lady of Guadalupe. And I thought it would be nice to end the presentation on a reminder of what Dr. Walks shared earlier, that masking continues to be important. And we know that good behavior change theory says that we need to not only provide information to allow people to make good decisions for themselves, but we also have to provide access to resources. So this past Saturday, the team from Austin Public Health and Austin Transportation were out giving away PPE. We gave away 654 PPE bags, and those packets usually contain 4 to 6 masks and some travel size as well as family size hand sanitizers. We gave out 600 disaster relief boxes, 600 boxes of food and veggies, 300 boxes of feminine hygiene products, as well as 500 pillows. And so just as a reminder, for year to date, through our PPE distribution events, we've served over 17,000 families and provided over 59,000 masks and 18,000 bottles of hand sanitizer. And so we are definitely having a full circle approach in not only encouraging people to be vaccinated, but encouraging them to continue to practice safety measures and providing them the tools, resources, and information to do so. And with that, I will end our presentation and ask if there are any questions.
Thanks. I think we've got Chief Bailey and Constable Morales to give us an update on the Travis County efforts as well, and maybe Chuck Brotherton.
Thank you, Judge, Court, and Council. Chuck Brotherton, Travis County Executive for Emergency Services. Just wanted to update the Court and the Council briefly on our continuing operations, our mass vaccination operations at the Travis County Exposition Center on Decker Lane. We are continuing weekend operations Friday, Saturday, and Sundays, typically for mass vaccine drive-through at Expo, even as we transition to strike team operations and pop-up events. So we plan to continue at Expo so long as there is demand. This past weekend, we delivered 1,385 doses over Friday, Saturday, Sunday at Expo, in addition to about 228 that we delivered at some pop-up clinics that Chief Bailey and Constable Morales will tell you about. So we see this continuing through June, likely into the summer, and perhaps shrinking our footprint at Expo for the drive-through operations, even while we continue supporting through the pharmacy operations, supporting our strike team operations. So with that, I will turn it over to Chief Ken Bailey with Travis County ESD 11.
So good morning, Council, Judge, Commissioners Court. Thank you for having us again. I'd like to start by saying that Constable Morales and I are going to be brief, but this is a combined effort of a lot of people, not really just us. Obviously, Travis County, Seton, ACC, Austin Public Health. There's a number of partners. Collaborative is now part of that. So the data that I'm showing you is specific to our strike team efforts from the beginning. And thus far, from the strike team perspective, we've delivered about 16,000 doses. I'd like to highlight that 83% of those are to people of color. Because of the way it's broken down with MTRAC, white shows to be a large number, but when you break that down to those that are Hispanic and then the non-white population, it runs about 83%. We are seeing a large uptake in the number of people under the age of 20 that are taking the vaccine, which is obviously with the changes from the CDC guidelines for Pfizer. The Austin Public Health had mentioned the zip codes that have the least amount of vaccine penetration. We've highlighted those, and those have become a priority for the strike teams. And then the question, which seems to us to be important, is what have we done in those zip codes? And I'll give you 78617 as an example. It's less than 50% of that population is vaccinated with at least one dose. But when you look at the next slide and you see where we've taken our strike teams, we have been in 78617, but how effective have we been is a larger question. And clearly, Constable Morales and others are starting to focus on our messaging in these areas so that we can bring those numbers to a higher level. And then I'd also like to point out that the last 2 weeks in those areas that have had less than 50% or that are our priorities, the last 2 weeks of doses, which include HEB, Austin Public Health, Community Care, TCFR, Seton, all of the providers, represents about 20% of the effort went into those 7 or 8 zip codes. And then the last thing that I'd mention is that we have geocoded, at least for the strike teams, in some of these hard to reach zip codes, so that we can start going street by street, whether or not it's the left side of the street or the right side of the street, with our efforts to educate and do some outreach, which Constable Morales is going to speak to in regards to our next steps with those outreach efforts. Constable Morales.
Good morning, Council, Commissioners, Judge, and Mayor. Right now, we're currently focusing on outreach and education so that when our teams are out there, they can be more successful. Together, we're working on a unified message along with Austin Public Health, Seton, Community Care, and other community groups so that we don't send mixed messages, such as locations, types of vaccines, ages, calendar of events, responding to questions, information of the vaccine, health issues and concerns. Right now, our vaccine education and community outreach is one of the focuses that as a team and a group we're out there, we'd like to make sure that people have answers to some questions like, the vaccine hesitancy, the reliability of the vaccine, and the types of vaccine given and the ages that can be taken. For instance, we're going to have a pop-up event on June 12th. That's at the Millennium Youth Complex. That is strictly 100% vaccine education with our community partners. Along with Commissioners Gomez, Trevelyan, Mayor Pro Tem Natasha Harper-Madison, Pio Renteria, coming together as a group and reaching out to our faith-based leaders, our trusted faces in the community, our familiar faces in the community, our nonprofits, making sure that, I'm sorry? Making sure that we can actually bring that information for anyone that has those questions or those hesitancies of why they should take the vaccine and how healthy the vaccine can be. Our main focus on community outreach is, again, using those trusted people in our community. A lot of the times we had a discussion on, do you know who your elected official is? Or do you know who your reverend is? Do you know who your priest is? Do you know who the person, at the community center is? Those are the people that we want to make sure that we get out there and we get our message out. Right now, in the last 2 weeks, we've worked on some of that part, and with the help of Travis County, we were able to get some staff members out to where we made almost 2,000 phone calls. We flyered almost 2,500 apartment complexes and mobile homes, and text messaging is about 2,000. So, as we increase that information and that effort, we want to make sure that people are comfortable with us getting out there. And we want to make sure people are comfortable with the message that we're giving. It's a scary process because some people are just unfamiliar with what we got going on. Just like before I said, we are working to reach the hard to reach areas. Those people with lack of transportation, lack of Wi-Fi, access to technology, those are the areas that are our focus and concern. And I'll move it back to Chief Bailey on that.
We're happy to answer any questions you might have. Chuck, do you have anything in addition?
Thank you, Chief. Just one other mention. I'd like to just give a shout out, Judge, Mayor, Court, and Council, to the Texas Army National Guard. They have been supporting our efforts both at Circuit of the Americas, now at Expo, and continuing to support us as we move into the community with strike teams. So Lieutenant Jose Torres and his folks have been instrumental in continuing to support and make our operation successful. So with that, we'll turn it over to y'all for questions.
Thanks, y'all. Thank you very much for all that. So we'll start with the questions. Commissioner Gomez, I'll recognize you first if you have any questions or comments.
Judge, I don't have any questions. It appears that we're going to where people are, and that is a very good strategy to try to reach as many folks and give them the time to ask questions and to get answers sufficient enough for them to want to get vaccinated. So thank you all very much for that effort.
Thank you. Commissioner Shea?
Thanks, Judge. I don't have any questions either. I just really want to acknowledge the work of all of our staff, and especially the ESDs and the constables. And I agree with Commissioner Gomez. It does seem that these sort of targeted strike team efforts, which I know my colleague, Commissioner Trevelyan, has been pushing for from the first we were having these hearings, are really paying off. And I just want to acknowledge everyone's hard work and efforts to try and protect our community and keep it healthy. So thank you all.
Thanks. Commissioner Trevelyan?
I'll echo my colleagues that I really appreciate the extra efforts that have been made by our staffs. I think that we've been willing to go out. We've seen a willingness to go out into the community. Judge, I think that you've made extraordinary efforts as well to make sure that people have access to vaccine. We are planning a few more events between now and Juneteenth. I just want to make sure that we continue to have the volume of vaccines that we need, because as we look at what is being planned by our constables at the Millennium Center this weekend, I think that could be a big event with a lot of people. And I think that Juneteenth will be huge as well, and there will be a number of events with a lot of trusted people all around the city. So I just want to make sure that they have the supply that they need to serve those difficult to reach parts of the community who we know will be out for events. So I just want to thank you all for all the efforts that have been done, and let's redouble our efforts until between now and the 4th of July to make sure that we're reaching as many people as we can. So thank you.
Sounds good. And the one at the Millennium, it's this Saturday.
This Saturday,
I think it's like 9 to 1. Does that sound right?
Constable Morales, could you give him the contours?
Yeah, it's going to be, it's actually 9 to 1. That's 9-1 is actually show up and more education with our vendors. There you'll have free food, working with community care to get out some gift cards for families. We'll have Kona Ice on site. And we want people to feel comfortable asking those questions when they come to this event, so that we can assure them that it can be safe, and try to answer any additional hesitancy questions they have.
I might have to at some point get some type of contest between the constable and I to see who has the best barbecue, access to the best barbecue. So I might have to throw the gauntlet down, constable, to see what you know out there.
It's funny you say that, Commissioner, because the guy I got was actually your friend. It's a friend of ours. This deputy actually works here in our office, so it's going to be tough. So we kind of focus on the same kind of barbecue.
All right, we'll check on that.
And it's 12 and up for Saturday, right? So it's the Pfizer y'all have on Saturday, George?
Yes, sir. We will have a vaccine team on site. It's 12 and older.
Okay, awesome. Thank y'all so much. Commissioner Howard?
Thank you. My question might be best directed to Charles Brotherton. On the maps shared in this most recent presentation, it doesn't include the entire Travis County, like north of the river. And I'm curious as to why is that? Is that just, is this the shaded areas where we've done strike work, or is this the city? A lot of my precinct is not shaded on the map. And I'm curious about the age of the people reflected in these statistics. Is this all human beings or just folks 12 and over, or what?
And Commissioner Howard, I will defer to Chief Bailey. He is the creator of those maps.
Commissioner, are you speaking to 78645 and 78641?
Yes.
That's my error. I'll have that corrected and get it back over to you. And these are first doses, or at least one dose, is what you were seeing.
Okay. But out of what, that I'm surprised that we don't have more folks with complete dosage on the, out west. And so is this all ages or just,
It is all ages, and I can actually get you a breakdown. All of the data that I have is specific, it is from dishes, and I have it divided into an east and west as well. So I can get that to Chuck, and who can then get it to you today.
I'd appreciate that. Thank you.
Thanks. Don't have any questions. Just want to say thanks, Councilman Morales, Chief Bailey, commissioners, for all that you're doing. And thank you, APH, also for being such a great partner in all of this. I think the strike team effort across the city and the county is moving things in a good direction. So I'll pass it on over to you, Mayor.
Judge, thank you. And again, commissioners, thanks for the joint session. Colleagues, we're going to go 1 through 10. Let's begin with the Mayor Pro Tem. Do you have any questions? Let's see the Mayor Pro Tem now. Somebody did earlier. We can come back. Councilmember Fuentes, do you have any questions?
Yes, thank you. My first question is, and first I want to say thank you to Chief Bailey and Constable Morales for all that you're doing for our community. It's just incredible to see the data that y'all laid out, where you're able to show us the targeted zip codes that you're working on as part of the strike team effort. And then show us where you've been in that zip code. I super appreciate that level of detail and information. And I'm so grateful for all the hard work that y'all are doing to get our community vaccinated. Chief Bailey, when you said that y'all are going street to street, that you're speaking my language, I'm right there with you. I was like, yes, that's exactly what we need to be doing. So just want to extend my gratitude to you all, and just so grateful for the strike team effort. My question is around just trying to understand, what is the plan to get the zip codes that have less than 50% of the population vaccinated with 1 dose? How are we going to move those zip codes? And what are the coordinated strategies? I want to ensure that our strike team effort with the county and with the county spearheading is aligned with the public health department's effort. So if Director Stirrup, if you could speak to that, and also if you could touch on the city's mobile vaccine program, how that's going, has that been utilized? Any type of information there that we should be aware of. So that's my first question.
Thank you, Councilmember Fuentes. As my colleagues from the county pointed out, the first thing is to make sure that we are having consistent messaging and that we're all saying the same thing. So there is a concerted effort to work on campaigns and to make sure that we're sharing the same information. When we talk about vaccine hesitancy, we're really talking, I read a really good article this week, and it spoke to me, because now we're really talking about vaccine equity. And so all of the things that we're doing to be in those communities that folks either have access or need additional information. So it will be a combination of all the things that you've heard today, right? So first we need to make sure that we're continuing to provide up-to-date, real-time information accessible at different points in community, whether it's going, that I love the health fair model approach, drawing people in with lots of tchotchke and joy and good food, and then giving them some information. And then if you can get them over the next hump, we get them a shot. Like that is like classic strategy for that. So, it's really about creating those opportunistic moments for people to get vaccine. And so as we begin to shift from our mass sites, we will join our county partners in doing more of a strike team approach. Typical van program back in the day before COVID, we were out at Walmarts and HEBs, HIV testing, giving screenings for blood pressures. We plan to use that same model for the vaccination strategy. So leaving places like Southeast Library and Little Walnut Creek, because they're neighborhood hubs that people can still gravitate to and have connection with, and then coupling that with using the map to see where we're below 50% and deploying our teams in those areas, reaching out to our partners. I mean, they hit the nail on the head. The trusted partners that will be having events that we can tag onto or that we can create events with. So it'll be a combination of messaging, providing good information, and then making sure that we have equitable opportunities in places where people work, play, and live to get vaccine. And I don't know if my partners from the county want to add anything to that.
No, I think you're on point. And again, you know, it's an exciting time to actually motivate, inspire, and educate people in our community.
Okay.
And one final point, council member, I would offer that there is a joint information team, public information folks from both county and city that are working together to craft messaging that is consistent, that has, you know, the same artwork, but editable text that we can use for door hangers, posters, all of that kind of literature that we're handing out just to make sure that we've got consistent messaging and consistent branding, if you will, for our combined efforts.
Thank you. And then, yeah, the other question I had is around the community goal to get to 70% vaccinated with 1 dose by July 4th. You know, I really, it'd be helpful if we were able to get some type of progress update as we have the different weeks go by from now until then, to see, you know, how we're moving that needle. And just, I want to get a sense of, you know, how successful our the vaccination efforts are when we have the health fairs and Juneteenth, and just trying to see, okay, because of these very targeted outreach efforts that are collaborative, this is how much we were able to move week to week to hit that community goal. And as much as we can share that out, that we're trying to reach 70% by July 4th. And I think we're at, what was it, 66% with at least 1 dose of Travis County, is that right?
Yes, that is correct.
Okay, that would be helpful. And then last but not least, I don't know if this was mentioned because I was a little late joining, but I did want to extend a happy birthday to Commissioner Gomez, and just want to wish you the best year yet and hope you have a great day.
You beat us to it, council member.
Happy birthday.
The short meeting would be great. Thank you.
Thank you. Councilmember Talia.
Yes, thank you.
Wait. I had skipped Mayor Pro Tem. And let me go back. And happy birthday, Commissioner. Mayor Pro Tem.
Thank you, Mayor. I appreciate it. And I can't help but observe the serendipity. So I wasn't on camera because I got a call from my mom, so I could sing happy birthday to her. So happy birthday, Commissioner Gomez. You and my mom are birthday twins, Geminis. So with that, I actually don't have any questions. And I want to, like my colleagues, extend the most gratitude for having watched all of these initiatives and departments come together. And I think we finally have found our stride with, like you said, Constable Morales, just going where people are. And so I think we're moving in the right direction now. And I just look forward to continued guidance from everybody here on how to best get the word out to our constituents. I'm getting more and more questions from people who had previously stated that they were hesitant. So I think the outreach efforts are starting to penetrate communities, and that makes me very hopeful. So thank you, everybody.
Okay. Now, Councilmember Renteria.
Thank you, Mayor. And also, happy birthday, Margaret. I'm a little concerned about looking at these 441, 87841 and 44. Is that, I know in some of these locations, especially in the Riverside area, there might not be any, and maybe if y'all have found any opportunity to set up any of the pop-up clinics in that area. It seems like, at 38 point something % vaccinated, is that just one shot, or is that the ones that haven't been totally vaccinated? I'm really curious that in that area, that it's that low?
So 38% represents one dose. So this map shows the distribution of one dose per zip code. And so, yes, the team is constantly working on where we can be in those areas. And in future reports, I hope to come back with either we completed an event or this is where we plan to be. But that's the purpose of having this map in front of us, to make it visual, of where we need to be and who we need to connect with.
Oh, thank you. I know there's a lot of hesitant going on in my community. I even have a nephew that he has a child and he don't want to take it, afraid, and I'm trying to convince him that it's just the opposite. And so if I have a nephew that's, and he doesn't want, he's afraid of taking it, and met a lot of people out there that are the same way that he is, but that has a child, and he's afraid of, I can't understand. I'm trying to convince him, but it's very hard to send out that message to people, especially when they're hesitant to take that. And I believe that if you get it closer to them, where it's within a short distance, where they can either walk or it's a short drive, that you'll get a lot more people taking it. So I'm glad we have identified those zip codes, and now we can concentrate on them. So thank you very much. And I want to thank all the other staff and the constables and county commissioners that are helping out. So I just want to thank y'all, and you're doing a great job that I can see. Thanks.
Thank you, Councilor Kassar.
I really appreciate the latest data that shows to us, as Councilor Renteria said, what we have known, which is that places like 78753 and 78741 not only aren't at 50%, that they're below 40%. So that's important for us to clearly see, but then for us to know that what we're doing is actually directly addressing that. And so in the other map, you show to us that the places where you have administered the most doses, when you're talking about our public efforts, are places like 78741, 44, and 53. So what I've been searching for is to see, have we really identified and continue to get a sense of the problem? And then is the majority of our work directed right there? And I think this is the first presentation where we've seen that you all, we can show very clearly to the public that we're aware of the continued disparities and the continued need, and that we're focusing our resources directly at that. So I just want to echo the thanks of everybody that's spoken so far at that continued effort. And knowing that effort is far from done, knowing that we have parts of town that are still under 40%, and I know y'all know that, and that y'all are working that, but I appreciate that we now have maps that can show that to the community. I am going to send a question in for our next presentation on the mortality rates, because I do think it is important for us to show those disparities that we have, but I also want us to be able to show and understand, even if some of the disparities may not be quite as severe in a place like El Paso, when you had 3 to 4 times the death rate in those cities, I think, it's clear that the mortality rate for Latinos here is lower than in El Paso or in Bexar County or in Harris County, even though we have a disparity in the death rate. And so I do think having those numbers would be really helpful for next time, again, for us to show our community where we're falling short, but then also what we're doing that is working. Because I think for us to continue taking careful behaviors and encouraging people to get the vaccine, I think it is really helpful for people to see what is working. So again, I really appreciate this presentation, because I think it gives me and members of the public clarity about what the path is moving forward. And I just want to thank everybody that's really working to target those places that are under 50% or even under 40%. So thank you.
Okay, thank you. Councilor Kitchen.
Thank you. I don't have any specific questions at this point. I do want to thank our staff. And I also want to say, I appreciate the questions that Councilmember Fuentes was asking and pointing out the importance of the targeted outreach that the county is engaged in. I really appreciate that effort and am hopeful that that's going to produce really good results. So, and then I agree with what Councilmember Cassar was saying. We need to really understand what it is that's making a difference. So again, thank you to everyone who's involved in this effort. And I hope that we can just continue the push to get as many people vaccinated as we can.
Okay, thank you. Councilmember Kelly.
Good morning and thank you. First off, happy birthday, Commissioner Gomez. I hope you have a wonderful day. Second, I wanted to thank all of the staff at both the City of Austin and Travis County for being able to provide these meetings for us jointly. I can think of no better way to communicate and collaborate across different government entities and work together to help solve problems across our communities. And for that, my heart is very full and I'm super thankful. So thank you very much.
Councilmember Poole.
Thanks. Just going to amplify all of the good wishes to Commissioner Gomez and to our staff for continuing to see improvements in our community on vaccination rates. Still hoping for that 100% achievement, which I hope we see really, really soon. So thanks to everybody.
Councilmember Ellis.
Thank you, Mayor. Happy birthday to everyone whose birthday it is. Are we seeing that the vaccines that are currently out are being as effective toward different variants as we would hope, or is there some more work being done to make sure our COVID shots in the future are effective against those variants?
So far, we're seeing that they are effective. There's ongoing research to collect data. And there is some talk of the boosters that are being developed, that they will have some focus on some of the variants that may need special attention as far as vaccine development goes, similar to what we did with the flu vaccines.
Okay, thank you.
Thank you. Councilmember Tovo.
Thanks very much. The information you provided today about the more granular detail about zip code level and the percentages based on age of the number vaccinated and whatnot was really very, very useful. I wondered if you could summarize for us any research that you're aware of that explains the different responses that women appear to be having to the vaccine in terms of their number of breakthrough. I know your slide noted something that seems to be supported by other areas as well, which is that women appear to be having more breakthrough cases than men. And I'm wondering what some of the prevailing theories are for why that's the case.
I don't believe that we have that data as yet. It's 51% women and 49% men in the breakthrough slide that I showed. So it's still early in the process, and I'm sure that we'll get more information as we go forward.
Okay. I'm aware that there have been some other articles about that, talking about how the vaccines may be slightly less effective for women. And so but thank you for pointing out that the data here in Austin is still pretty close in terms of breakthrough rates. Okay, thanks, that's it.
Thank you, Councilmember Halter.
No questions, and I join my colleagues in thanking everyone for their hard work.
Great, thank you. Dr. Walks, thank you to the welcome to the combined meeting of the council and the commissioners. I also want to thank for the presentations today that have the demographic information over time. I think that does tell us and reaffirm that the direction we're taking is in fact moving the percentages that we want to get to the most vulnerable over time. It's kind of interesting. We see that the mass events get to more people, so they get to greater absolute numbers of communities of color. The more targeted events don't get to as many people, but get to the greater percentages. Clearly, the direction we need to be going now is fewer and fewer people are going to the mass sites. I would also like to see the mortality numbers, both for what we're doing here, but also compared to other jurisdictions, to see if other folks are doing something that we need to take a look at to be able to do better. I would be interested in knowing, do we have the data or the numbers to be able to present the percentage of people that are new cases or the percentage of people that are new hospitalizations that are vaccinated or not vaccinated? Is that data available?
I've asked for that, Mayor. We do not have it as yet, but as soon as I get that, I'll distribute it to the group.
Okay. I think that'd be an interesting thing to see, and it may help with the hesitancy issues just to get that information out as well. I think it was a city that was now publicizing, and I think their numbers were something like 98% of their hospitalizations are people that have not been vaccinated, which is an incredibly high number. And I'd be interested in knowing if we're seeing the same kind of thing here. But congratulations to the county and the strike teams and what we're doing with APH, that more targeted stuff. Activity right now seems to really be working. We now have a track record to really be able to look and see who the trusted partners are in the community that are delivering the greatest number of targeted people at events for us to get vaccinated. And I urge you all to rely on them and look at those track records. Some of those folks, I think, are asking for additional support in order to amplify their voices. And if that makes sense to do based on the track records we're seeing, I hope we're considering that. Judge, I think that takes us through all of our folks. If you want to tee up the next presentation.